One of the big silver linings that came out of all of this innovation within the US was how we use telehealth. And this is not just our story, but number of health systems throughout the country who just tremendously grew their telehealth programs during this time. Here's one graph which I'd quickly share with you. And you can see a program predated COVID by many years. So we had a good governance, we had a good framework. But in the early years, it was very purposeful growth, right? So if you look at FY16 through 18 or 19, it was a very, very purposeful growth. And we were talking to physician groups and asking them who's interested. We were essentially taking a vote to say, hey, do you want to try this? And if you do, let's create a program for you to see how it'll fit you. And then COVID hit, and you see the numbers out there. Now, in FY19, as we were planning for FY20, our goal was about 7,000 telehealth visits. And we thought 7,000 was a stretch goal. It'll be hard to meet that. And we hit about 86,000. Just from a fiscal year perspective, a fiscal year starts in September with the university's school year. So it's a little odd. It's not tied to the calendar. And we've already hit 100,000 visits for fiscal year 21, which is where we are in, a little over 6 months into it. So again, we're continuing to see that growth. Now, there were a couple of things that were happening during the crisis which made this happen. One was when we talked to the providers, there was really no other way for them to take care of their patients. And when that happens, they are much more likely to adopt and adapt and go through the bumps of a new technology implementation. Another thing was the patients did not have a choice. The safest way to get healthcare was through telehealth. You don't have to come to a clinic. You don't have to be in interaction with people. You're safely in your house, so you are socially distanced. And thankfully, viruses don't transmit through telemedicine. So it was great. So at least from a supply side and a demand side, there was a deep congruence. And then finally, the federal government pushed in with payment parity, which meant that we were at least getting paid for it. They also allowed for certain other rules where you could do interstate telemedicine and stuff like that. And I hope some of those rules stay because they'll be extremely beneficial for the country in the long run. Now, when you look at our success and how we achieve 40x growth, we essentially did a few things. One is from a provider perspective, we provided them training one-on-one and ensured that their staff who supports them was also trained in troubleshooting the basics of telehealth. And so they didn't have to wait for IT to handle some of the simpler issues till they got comfortable with it. Once you do a few hundred of these, it becomes normal for you. From a patient hesitancy side, if you hadn't done telehealth, you were not technology savvy, there's always this, why am I doing this? And one of the things that we built out was this program to actually call out the patients a day or two before the visit, get them set up, upload the app onto their devices, and actually have them log in and test out telehealth before their actual visit. And all of this was done to make them comfortable with the technology, make them get through the hesitancy issues with a new software being used, and also make them just comfortable that there is somebody that can help them out if needed. Now, we did this in the early days with our IS staff volunteering to help out with it, but we have subsequently moved it to a service that actually makes these calls and gets them set up, especially the first-time telehealth users. The other interesting thing that we worked on was we knew that if the first experience wasn't good, it's going to be problematic. If your first experience with technology is not good, it'll take you several months to several years before you try it out again, right? And that's true for anything. If your first Facebook experience wasn't good, you would have jumped to another medium. And you can see how even in social media, things have come and gone just because the next thing's experience was much better and the number of people were there. We had to re-platform our video communication system in the midst of COVID because our original system, which we had since 16, couldn't scale up to 40x. We also had to ensure that the workflow is embedded in the EHR. So if a doc was seeing the patient, they could actually see their entire schedule and click on a button to start the video visit. Now, this was important for us because we were already thinking about a future world where it'll be a hybrid world. Some patients will be seen in person and some patients will be seen through video. And whenever you get to that kind of a world, we knew that a single schedule where the provider could actually see that the patient has been in the room and ready and waiting for them, or on a video call and ready and waiting to them be on a same system, on the same view, so that they can toggle back and forth between real and virtual. Finally, we added a whole bunch of features, multi-party calling, because we also wanted an interpreter to be available. If one of the patient's parents was not with them, they could connecting from another location. And then the other big aha for us was SMS-based meeting links. One of the things we realized is, whereas 81% of the US population has smartphones, the population that actually uses emails consistently is slightly smaller. And the other thing we realized about texting is that it's quick and simple. The read rate in texting is 90% within the first 3 minutes. The open rate is 98%, and the response rate is 45%. Now, of course, it's not secure. There's a character limit, and you have to be careful about what time you send a text out, right? So you have to send it within the waking hours of that particular market, versus emails you could just send anywhere and they'll accumulate in an inbox, and whenever the person wakes up, they can check it out. So lots of learnings out there, but texting became a bigger mechanism for us to communicate with our patients.